Hello, I'm presenting my poster, which is titled Service Experiences of NDIS Participants in Rural and Remote Australia. NDIS stands for National Disability Insurance Scheme, and it is the current funding system for individuals living with a disability in our community, and it provides reasonable and necessary supports to those individuals. NDIS funds people from 0 years of age to 65 years of age, and the funding is used to purchase services and supports that meet their needs, whatever those needs may be. NDIS funded supports include cognitive and emotional tasks, healthcare, community participation, formal communication activities, mobility activities, etc. There is a view that disability support services decline the further away a participant lives from an urban center. And urban centers are major cities or cities with a population of 50,000 or more. And rural and remote areas are classified as centers or geographical regions with a population of below 50,000 people. So this paper is looking more at the rural and remote Australia, so those places with 50,000 or less people. Social workers can assist by reducing social barriers, like access to services and injustices, by advocating for social and systemic changes to ensure that services are equitable. So a literature review, I carried out a literature review of 4 evidence-based practice research papers in disability support services in rural and remote areas. And the reason was for, to understand or to prove whether that view of that support services decline the further away a participant lives from an urban area. And this was to be in comparison to those living in urban areas. All studies that I looked at utilized qualitative research methodologies. What I found by carrying out this literature review was that the demand for disability support services in rural and remote communities is higher than the available service providers. And this is due to a shortage of qualified health professionals in rural and remote areas. The results, and this results in delayed services. And then the other thing I found out is funding inequality, where there was notable inequality in the level of funding participants received despite similar diagnosis. And the other finding I found was participants were forced to travel for long distances to access services because the services were not available in their own communities. Social workers who are committed to applying critical thinking in their professional practice can assist to bridge this gap by adapting a general, by advocating to improve service provision for NDIS participants who are living in rural and remote areas. And some of the ideas I came about through the literature review is we can adopt a generalist model of care to meet the unique needs of people living in rural and remote participants. We could introduce Aboriginal and Torres Strait Islander health workers to provide services to First Nations peoples, and these will definitely improve their well-being and service satisfaction. We can advocate for block funding, which was the system of disability funding before NDIS. And this would ensure that providers have autonomy to use funding in a discretionary manner, which means they would be responding to the needs of the people in their community who require disability support services. And this would reduce the wait times or the need to travel long distances. So in a nutshell, my research found out that access to formal disability support services declines the further away one lives from an urban center, and this leads to inequality of desired outcomes and overall health and well-being of participants living in rural and remote Australia. Thank you.